Hi, it's Dr. Osafi at New Life Dental Implant Center. I wanted to take a quick second to talk to you about a funny topic, getting dental implants done in the USA versus getting them done anywhere else in the world. I hope this doesn't flare up any controversy, but let's get started. So getting dental implants done in the USA, there's a lot of reasons that you may think and consider getting dental implants done in the US because of one, getting that assurity that there's a standard that's being met that you're familiar with. You know that there's 4 years of undergraduate schooling that's required after high school, and then you're going to dental school after that for another 4 years. And then depending on the specialty, like for example for periodontology, it's a 2 to 3 year specialty, and then for oral maxillofacial surgery, it's about a 4 to 6 year specialty beyond dental school. So you know that this person has been in school for a really long time getting trained on that specific specialty, as opposed to some other countries that really allow dental implants, for example, to be placed after just 4 years of undergraduate studies in dentistry. Very different, and it doesn't necessarily mean that they're not experienced. It's just something to consider, knowing that the amount of time that's been spent placing dental implants is just less compared to those that have been trained in the US and having had that kind of prolonged training in dentistry. Another reason to consider getting dental implants done in the US is really the possibility for issues that may arise after the treatment. And because there's a lot of attributes of dental implant treatment that really depends on the patient's ability to heal, and depending on how fast you heal, really you need to have some follow-ups, and it's typically difficult. If you're living in the US and you're expecting to fly back and forth between the US and, for example, Mexico, it may not be a big deal if you're close to the border, but it may be difficult getting in, and just coordinating schedules is difficult. And the third reason to really consider is the amount of liability that a dentist is held by when they do a procedure in the US. And you know, we're in the US practicing here in California, we're held liable by the dental board. We're also held liable by the California Dental Association, and then the Federal Association for Department of Health. So we have to make sure we meet those standards, and the American Dental Association, which governs really all dentists nationally. Without meeting those standards, your dentist will be in trouble if they make a mistake, as opposed to getting dental implants done in a country where those standards may not exist. And unfortunately, the dentist may consider doing something to a substandard portion where they could just see it as something that would fly away and would not really come back to haunt them. As opposed to getting it done in the US, you're really holding yourself responsible not just to the patient but to the board and to the standards that have been set by the organizations that really define what we do. So I hope that kind of helps you make a decision in getting dental implants done in the US as opposed to other countries. Again, I really don't mean in any way that you won't get good work done other places, but there are some things to really consider when trying to decide whether or not you're going to fly somewhere 4 to 10 to 20 hours away to get some treatment done. So hope this helps. Thank you guys for watching.